Good afternoon, and welcome to the 2026 State of Vail Health. My name is Will Cook, President and CEO of Vail Health, and I'm excited to share with you some of the things that have been happening here. I like to start every meeting by grounding us in our mission and vision as they remind us why our work matters. Next slide, please. If you look back at our history, it informs both our present and our future. By understanding where we've been, we gain clarity about who we are today and get confidence in where we're going in the future. And if you look at the 7 years since I've been here, there's been a lot of growth, a lot of significant growth, in fact. But that growth was very strategic. For example, bringing Colorado Mountain Medical into Vail Health significantly increased the number of primary care physicians and specialty physicians that enable us to elevate health across the mountain communities we serve. Tackling behavioral health, which is, I would argue, the biggest crisis of a lifetime in the healthcare industry, was a necessary thing to do. And now that we have the Precourt Healing Center open, we're the only inpatient behavioral health unit between Denver and Salt Lake City. Thinking about ways in which we can grow in new markets are extremely important for small independent systems who have difficulty growing their way out of financial challenges. As a result of it, instead of just being a hospital at the base of Vail Mountain, we are truly a comprehensive community healthcare system. We can take care of almost all of your needs. Now, of course, there's some that we can't because we don't have the volume to ensure quality or maybe cost efficiency. But know that accessibility is one of our pillars, and we're constantly looking at ways that we can be a great community healthcare system for you. If you think about it, we've grown from not just the Eagle River Valley, but we now are in Summit County and the Roaring Fork Valley. And we're not there alone. We're doing it in partnership with Aspen Valley Hospital at our new ambulatory surgery center in Basalt, for example, with the Stedman Clinic, and with so many others. Next slide, please. That's why I feel like Vail Health truly is the most modern healthcare system in the world. We're an independent community healthcare system with a strong financial background, a good A- bond rating. But what I'm most proud of is our quality and our patient experience. We have CMS 5-star rating and 8 consecutive Leapfrog grade A's for quality and safety. There's about 5,000 hospitals in the United States, and only about 400 of them can say that they are both 5-star rating and Leapfrog A. And that's a testament to our amazing team of staff and providers who provide outstanding care day in and day out. And how do we do it? We focus on people. We focus on taking care of our people. We focus on taking care of our community. And at the end of the day, this is why we're all here. Next slide, please. Let's talk a little bit about our FY25 accomplishments. First and foremost, as I said before, we're constantly looking at ways that we can invest in our people. This year alone, we spent $11.75 million investing in things like annual merit awards, market adjustments to ensure we're offering a competitive pay, discretionary bonuses. We more than doubled our housing inventory, spending $20 million as an example on the Fox Hollow facility in Edwards. We tripled our housing subsidy from $1 million to $3 million. We all know how challenging it is to live in these mountains and how affordability is truly a challenge, and we keep investing our people at every turn. Behavioral health, so much happened in that space this year and has been happening in the space for the last 5 years. Things culminated this year with the opening of the Precourt Healing Center, as I mentioned previously. That happened on May 5th of 2025. That's a 28-bed inpatient unit located over in Edwards. And I just want to say thank you to the community who supported us in that endeavor. We're excited to have it open, and we're still learning. It'll take us 2 to 3 years to figure out exactly what we're doing there, but that's okay. That's what happens when you open up a new service of that magnitude in a new community. We increased the number of outpatient behavioral health visits. On any given month, we're seeing 4,000 to 5,000 patients each month on an outpatient setting for behavioral health issues. The Uyghurs outpatient facility is amazing. We integrated behavioral health in primary care. We integrated it in specialty care. It's integrated in the schools. We tried to remove the stigma. We made sure that we had a crisis response center. We've worked hand in hand with law enforcement and with our EMS community to ensure that together we could do our best to fight this terrible disease. And as a result of it, suicides have been reduced by approximately 60% year over year in Eagle County. Take a minute to think about that. That is amazing. This is why we do what we do. And again, we did not do this alone. This took the entire community, elected officials, government officials, law enforcement partners, ECPS, schools, benefactors, our board, you name it. I'm so proud of what we've accomplished in behavioral health and so grateful to the team that's made all this happen. Next slide, please. Well, we also launched a few other initiatives. Staying in the behavioral health space, we launched our Optimize study. This is the study where we're using psilocybin, which has been proven to help with severe depression and other types of disease states. We also have the Shaw Cancer Center working collaboratively with the Steadman Philippon Research Institute on a variety of cross-collaborative studies. For example, in orthopedics, when you injure yourself, or let's say when you have surgery, you're typically dealing with scar tissue, fibrosis as they refer to it. In cancer, similarly, if you have to have radiation therapy, let's just say of the breast, you typically are dealing with an unintended consequence of fibrosis or scar tissue in the breast. So the team collaborated from the Steadman Philippon Research Institute and the Shaw Cancer Center to figure out, can we take some of what they're learning in orthopedics and apply it in the cancer center? There's many other things happening from a cross-collaboration perspective in research, including with our Behavioral Health Innovation Center. I'm so proud of the team as they continue to try and find new ways to treat cancer and to treat other disease and illnesses. We launched Vail Health Span. We had our pilot program in 2025, but now that we're in 2026, it's up and going. This isn't just about longevity and the quantity of years in your life, but it's also about the quality of the years in that life. What can we do to elevate your health? What can we do as your partner to help you live your best life? How can we move from not just saving lives, which is what we do in places like the Shaw Cancer Center, but changing lives? How can we help people live their best life? We also expanded several other service offerings. We were so proud to add allergy and immunology into our system. Dr. Reagan Pyle is amazing. I'm sure many of you know her and have used her services. We have concierge medicine going now. Dr. Melissa O'Mara, she's amazing as well. We've expanded breast surgery. That was an area of opportunity for us. Things are going very well with Dr. Stephanie Miller. And we've also expanded urology. We're offering clinics down in Eagle now. We have Dr. Delara here, and we're doing many other things to look at how we can address more comprehensively both women and men's health. Next slide, please. But we didn't stop there. One of the big things that we did in 2025 was we conducted our community health needs assessment. I'm going to talk about that in a minute, so I won't go into detail now. But getting input from you all is really important to informing what it is that we do. But doing a community health needs assessment takes a lot of work, and that's why it's one of our accomplishments for FY25. We also are almost done completing our multi-year strategic plan. I list it as a 25 accomplishment and say that we're almost done because that too is a long process that crossed over 2 years. We spent time talking with our community through our CHNA. We spent time talking with our providers, our staff, our board, so many other key constituents to come up with what would be our next strategic plan. I'm excited to tell you about that in a minute, but that too required a lot of work, and it will position us well for the future. We also began the implementation of a standardized, system-wide electronic medical record. We're going with Epic. That's probably a system you've heard of. We're doing it with UC Health because they have access to Epic, which will help us ensure that we maximize all that we can get out of that. That's happening as well with some of our neighbors. It's a common thing to do. And we're very, very excited because it's going to enable us to have one system so that when you go to Colorado Mountain Medical and you see your primary care physician, and then you get care somewhere else within our system, let's say you go to the emergency department, or you have a surgery, or you go to Howard Head, now your provider, irrespective of where they're providing care to you, will be able to see what's been happening in all the other places within our system you visited. This is a huge enabler for us as we talk a little bit later about ways that we can get more preventive with care. But it's also a massive undertaking, and it doesn't only happen in 25. We're going live in the fall of 2026, and we continue to spend a lot of time on getting that new electronic medical record implemented. Another thing that we did in 2025, and by we, I mean our amazing foundation, our incredibly generous benefactors, and so many members of our community are bringing to an end our It Takes a Valley campaign, the $100 million goal that we set several years ago to help us fund behavioral health. I'm very pleased to announce that that team was able to raise $126 million. Almost half of that money, by the way, didn't come to Vail Health. It went on to our nonprofit partners like Speak Up, Reach Out. And that really, from my perspective, is why we were so successful in our campaign. Collective impact. Thinking about how together, if we lean in, there's nothing we can't do, including beating a $100 million campaign goal by 26%. Truly amazing. Truly only happens when you have a vision of doing something that compels people to give, and when you have a community such as ours that is as generous as they are. So thank you all for that. That's a huge strategic enabler for us. We wouldn't be able to do all the things I mentioned before in behavioral health, be it outpatient or inpatient or otherwise, without this incredibly generous giving. Thank you. But I can tell you all day long about the things that we've done, and to some extent, it may sound like it's self-serving, but when you receive feedback and acknowledgement from state and national organizations, it really validates what you're doing. And I'm not going to go through every one of these, but I want to make sure you understand this isn't just any small independent community healthcare system. This is one that punches well above its weight class, that puts at the center of everything that it does people. And I say people on purpose. It's our staff, our providers, our community, our patients, their family members, and they're driven by excellence. They're driven by a desire to be the very best. And when you do that, good things follow. Next slide, please. So a community health needs assessment, what is that? Well, it's what it says. It's when we get together with our community and say, what is it that we are doing well that we should keep doing? What is it perhaps that we're not doing that we should consider doing? What is the feedback that you could give us that would enable us to do a better job of serving you? Again, bearing in mind, we probably won't ever be able to do transplant surgery or brain surgery, and there's other things that just don't make sense here. But to the extent that we're able, and if it makes sense, we want to do all that we can to help you deal with your health. We had 160 different Eagle County residents meet with us over multiple meetings. The focus was on three key initiatives: improving communication and accessibility. And I think that will actually happen as we're on one electronic medical record. I think obviously access to healthcare can mean a variety of different things. There is, do we have that type of care in this valley? Can I afford to use that type of healthcare? Do I have access to insurance? Have we thought through cultural sort of differences related to how we utilize healthcare? We're really paying attention to that now. Health equity is really, really important to us. And equitable care and whole person health came up over and over again as we were talking with people. So thank you. If you were one of those 160 people that participated, we really appreciate it. And know if you want more information on our CHNA, you can go to our website. The URL is there at the bottom of the page, vailhealth.org/CHNA-2025. This really will help inform our strategic plan, which I'm going to talk to you about here in a minute. Next slide, please. So again, being a community-focused organization is really important to us. It's why we're here. This is your health system. You should be proud of it. You should be a part of it. And when we think about community benefit, I think it's important to understand that Vail Health has provided more than $147 million in community benefit in the past 6 years. I'm so proud of that because that's why we are here. In fact, in FY24 alone, we provided $34 million to more than 60 local nonprofit partners with cash or in-kind donations to support their initiatives. Because it takes a valley. It truly takes a valley. We can't do it without having those other nonprofit organizations that are part of our ecosystem, all leaning in and helping one another. As you know, we committed over $200 million to behavioral health, and it truly is transforming lives. So proud of that. So grateful that we have it. So much more that's happening that you'll be hearing about from a community perspective. Stay involved, volunteer, give us input. Let us know when we're doing something right. Let us know when we're not. It really means a lot to us. that we are a good community organization. Next slide, please. So as we look ahead, right? As a CEO, I'm learning all the time about being mindful of my words because words matter. On one hand, you have a tendency to think about the parade of worst case scenarios and all the things that could go wrong. But in so doing, you sometimes forget that you're not thinking about all the things that can go right. And how can we as a community, how can we as an organization take some of these challenges and turn them into opportunities? We all know American healthcare is broken. I don't mean that disrespectfully to anybody who's involved in it, myself included. I've been in it for 25 years or so. But it's broken because it's hyper focused on when you get sick, or when you get a cancer diagnosis, or when you get chronic diseases, or when you get into an accident, or you crash your skis on the mountain. And it's not really focused on what are we doing to try and keep you healthy. It's sick care, not health care. And so when you heard me mention earlier, we need to do a better job of balancing saving lives. It'll always be important. If you get that bad diagnosis, come to us. If we can't provide the care, we'll get you connected to somebody who can. Please know we'll always be doing that. But we want you to also come to us to think about ways that you can get healthy. We got to think about how we do it differently because the current model is not financially sustainable. And I know affordability is on the top of everybody's mind, not just housing, but healthcare affordability. And when you see things like the premium tax credits were reduced or went away, and how insurance premiums were going up between 15 and 30%, I want to make sure you understand our reimbursements, what we get paid, did not go up by 15 to 30%. In fact, our average reimbursement went up by less than 1%. Our average reimbursement went up by less than 1%. Our expenses are going up at a pace of 4 to 5%. I went to Texas A&M. I'm a finance major, so no jokes here. But I will tell you that math is upside down. And if we don't begin to think about how we make things sustainable at a macro level and a micro level and make them more affordable, it will fail. Let's go to the next slide. So the financial health of Colorado hospitals. So it's not sustainable for us either. 70% of Colorado hospitals now have unsustainable operating margins, negative operating margin. Nearly 85% of the rural hospitals do. It's even harder for the rurals because we, again, can't grow out of our problems. We can't scale as easily. It's hard, as an example, to spread the cost of back office functions like human resources and information technology and all of those things across a smaller sized organization. And if you continue to see expenses outgrowing revenue, you know where that kind of points you. And we're not immune to all these challenges, and it's happening across our country. Next slide, please. So, how does that inform? How does everything that I just said to you, what our mission and vision is, our recent history, our long-term history, the things that we've been focused on, the accomplishments, the expanded focus on behavioral health and looking at new markets, how does that inform our upcoming most recent new multi-year strategic plan? Well, after spending all that time with you all in CHNA meetings and spending time with our staff and our providers and with our board and other key community constituents, we had a retreat back in the summer. And what came out of it was 3 strategic concepts: being a community-focused organization, being an innovation hub, and a destination for health. I'm going to say it one more time. Being a community-focused organization, an innovation hub, and a destination for health. And you may say to yourself, well, what exactly does that mean, Will? Well, I think you understand community-focused organization, but innovation hub means how can we be on the cutting edge of not just figuring out ways to treat disease or to improve treatments. It also means how can we be out there thinking about new models of care? How can we be thinking about ways that we do things differently? And destination for health, yeah, it speaks to the fact that we have the most amazing, beautiful mountains that pulls people from all over the world, all over the country. We live off of our resort economy. Everybody does, Vail Health included. And we're so lucky to have had someone like Dr. Stedman and now Dr. Philippon and the Stedman Clinic physicians who bring people from all over the world. In fact, pretty sure many of you watch the Olympics and have been watching the Olympics. I don't know about you, but I get the chill bumps and pride every time I see the flag go up and they're singing the national anthem. And I think about those amazing athletes. And I think about that alongside them is the Stedman Clinic and Howard Head Sports Medicine as the medical provider partners of the U.S. Olympic ski and snowboard team. In Vail, Colorado, that's us, gang. And yes, that will always bring people from all over that help us fund things for our locals. But that's not just what Destination for Health means. It's destination for your health. And what that means is how do you come to us to get healthy and stay healthy and live your best life? How do we partner in that care? You have to own your own health, but we'll help you. We'll be your partner. We'll help you figure it out. And together, we can build new models of care with a community-focused mindset that plays to this spirit of innovation that has been the secret sauce that has made this Vail Valley what it is today. And I think with these three concepts, we will do amazing things, irrespective of how difficult it is out there, irrespective of how unsettling things are. I feel very bullish about our future. Next slide, please. So, what are our top priorities for 2026? Now, my team gets on me a lot about this. We agreed to like three things, and the next thing you know, it's four things, and it's five things, and that's a fair statement because we have to ruthlessly prioritize to bring some of these big projects into landing, including the strategic plan you just heard me talk about. But see how number one on this list is increasing preventive care and proactive care options. I go back to the strategic growth, at least since the 7 years that I've been here. And when I said bringing Colorado Mountain Medical into our family that had primary care physicians and specialty physicians, and we talk about tackling behavioral health and using research, how's that all unrelated? We have to think about whole person health. We have to think about physical health, behavioral health, social determinants of care. We have to think about relationships, how you fit into large and small group settings, and having now physical health and behavioral health and research and health span and all of these things you heard us talking about. It positions us, including Epic, by the way, it positions us to really focus on prevention and wellness and proactive care and elevating health across the communities we serve. So, big area of focus for us. We're going to get this strategic plan. We're approving it at our next board meeting on April 7th. I'm excited for that. I look forward to their continued feedback, which, by the way, we have an amazing board. Our board chair, Tom Gorey, was the chair of Duke Health, like the Duke University Health, for 12 years. And we have an amazing group of volunteer board members who give us unbelievable strategic direction and support. So a huge thank you to them. We started our journey towards Epic implementation in 2025. Again, as I said, we'll implement it in the fall. It will take us a while to figure it all out. There'll be a lot of communication coming out. Sit tight, I promise you. We'll help explain it all to you as we get closer. You may have seen a recent press release about how we renewed our support agreement with the Stedman Philippon Research Institute. If you hear me say SPRI, that's what that is. For an additional 5 years. That's really important because if we want to continue to be the provider to the U.S. ski and snowboard team, if we want to continue to bring people in from all over the world so that the people who live here can have access to that same care that those Olympians and those professional athletes have, we have to do research. We have to remain cutting edge. And there's some amazing things that are happening there, and we're going to continue to double down on that. We're going to continue to launch out HealthSpan. We're going to continue to look at expanding services at Colorado Mountain Medical. Pay attention to hormone replacement therapy. We've got an aging population. We had so many different people doing different things in this space, and we're trying to bring it all together and say, okay, let's have one approach to this. What are best practices? How can we help our women and our men who might be out there struggling with hormone replacement therapy? We got ophthalmology coming back. I know, it shouldn't have ever gone away, but as you probably know, it's a little difficult to recruit and retain people to this valley, but we've got some amazing providers coming in March. There will be information coming out about that as we get closer to it, but it's right around the corner. We've got other things happening in family medicine. We added more providers in Vail. We're looking at internal medicine, pediatrics in Eagle and Avon. As I mentioned to you, urology has gone out to Eagle. We're looking at ways that we can grow women's and men's health. So a lot happening in 2026 and looking forward to us being successful in that regard. Next slide, please. So what are the key takeaways? We have a clear plan for the future, driven in part by looking at our past, driven in part by thinking exponentially. And 10 years ago, thinking 20 years out. One of my execs always says to me, when's the best time to plant a tree? It was 10 years ago, right? And so, how can we take our new multi-year strategic plan with all the things that I just mentioned to you, with taking feedback from our community health needs assessment, taking feedback from our staff and providers, taking feedback from our partners in the community, including our state officials, our federal officials, the local officials, and figure out ways that we continue to focus on prioritizing the community's needs and changing the way healthcare is delivered and hopefully how much it costs. How can we improve access and provide a more coordinated and better experience? Oftentimes, the left hand doesn't know what the right hand's doing, and we own that. You could see someone in Colorado Mountain Medical and be on all scripts and then go up, somewhere else in the health system and you'd be on Cerner. That's not our best foot forward. And that's why we're moving down the pathway we are with Epic. It's just the first gate to improving access and providing more and better coordinated care. How do we stay focused and continue to be focused on research and innovation? And most of all, how do we get better at changing lives and not just saving lives, at increasing preventive care and proactive care options? And I'm excited to do it with all of you. And with that, I'll finish my piece of the presentation